Joining us now is Representative Frank Pallone, Democrat from New Jersey. He is the ranking member of the Energy and Commerce Committee, here to talk about many things going on in Congress. Representative Pallone, thanks for your time.
Thank you, Pedro.
In talking with our previous guests, talking about where Democrats are as far as what they want to keep the government open, let's start with that. What would you and your caucus want?
Well, I think the biggest concern I have is this healthcare crisis that President Trump has created with his big, ugly bill. So as far as I'm concerned, the most important thing is to address that, which is, first of all, that we have to have the subsidies for the Affordable Care Act so people don't lose their insurance, and also reverse the Medicaid cuts that are so devastating to our hospitals and our healthcare system.
Can you elaborate on that? Because when it comes to the Affordable Care Act, specifically, what is being called for by the Republicans?
Well, right now, for example, in the big ugly bill, they did not continue the subsidies for the Affordable Care Act for certain categories of Americans. So, for example, you might be paying $100 a month now for your health insurance because it's subsidized with tax credits, if you will. And now it's going to go up to maybe $300 or $400 a month because they didn't continue the subsidies that end at the end of this year. And so you could end up having, 10, 15 million Americans who lose their health insurance because they can't afford to pay the difference.
So if that's one of the things you want at this stage of negotiations, how willing do you think Republicans and specifically leadership is willing to offer that?
Well, first of all, Pedro, you know that there are no negotiations, essentially. I mean, the Republicans are they're fighting amongst themselves over what should be in this spending bill. And, they're in charge. And at this point, they're not really negotiating with us. They're negotiating with themselves. And they haven't been able to come up with a plan to avoid a government shutdown themselves. I mean, they're in charge, and we have nothing at this stage.
If that's the case, would you be okay with letting a shutdown happen?
Well, I think the bottom line is that certain things have to be done. And most importantly, the president can't have unlimited power. Right now, I mean, my concern would be, we pass an appropriations bill, a spending bill, and then he starts with recisions and takes everything back. So there has to be some way to make sure that he's not just going to have unlimited power to do whatever he wants if we pass a bill.
That's the pocket rescission when it comes to foreign aid you're talking about?
Well, it's for foreign aid now, but he can propose it for anything. He can make more cuts in healthcare and energy, in whatever he decides, because he takes the position that he can rescind anything. And that has to stop. I mean, it's a disaster, and it's totally contrary to the Constitution.
As far as from leadership, the minority leader, Hakeem Jeffries, what exactly have they offered at this point as far as what's going to be done between now and the deadline that's coming up when it comes to spending?
Well, I think Hakeem is taking the same position that I'm articulating, which is that there's a healthcare crisis, and that has to be addressed. And so the Medicaid cuts have to be reversed, but most important, the Affordable Care Act subsidies or tax credits have to be renewed so people don't lose their health insurance.
Our guest is with us, and if you want to ask him questions about these and other topics, Representative Frank Pallone, Democrat from New Jersey, 202-748-8000 for Democrats, 202-748-8001 for Republicans, and Independents, 202-748-8002. If you want to text us your questions, you can do that at 202-748-8003. Representative, on the larger issue when it comes to health care, you and all others, I suppose, on Capitol Hill saw the back and forth that took place between the Health and Human Services Secretary, Robert F. Kennedy Jr. What did you think of it overall, and particularly if you have concerns of what happened, what were those concerns?
Well, I think that Robert F. Kennedy Jr. is totally unhinged, and he doesn't know what he's doing. He doesn't belong there. It should never have been confirmed. The biggest concern that I have is this anti-vaccine policy. I think that if it were up to him, we wouldn't have any vaccines at all for anything. And this idea that a COVID vaccine, should only be administered to a limited group of people is outrageous. There's no scientific basis for that. And everything's been thrown into chaos right now. You talk to pharmacists and they'll tell you, we don't know what we're able to give out in terms of COVID vaccines, what we're not able to give out, whether we need a prescription or not. And many people now can't find a COVID vaccine. let alone have it for free, which it used to be. So I mean, this kind of chaos can't continue. He just basically is an ideologue who's unhinged and really doesn't know what he's doing, and he's making our public health system, which was the best in the world, second rate, to the point where people have no idea what's good for their health based on what he says.
Representative Pallone, one of the things he did talk about was actions at the CDC, the removal of some people, and one of the reasons that he did it, and he related it to COVID. I want to play a little bit from his hearing last week and get your response to it.
CDC failed that responsibility miserably during COVID, when its disastrous and nonsensical policies destroyed small businesses, violated civil liberties, closed our schools, caused generational damage in doing so, massed infants with no science, and heightened economic inequality. And yet all those oppressive and unscientific interventions failed to do anything about the disease itself. America is home to 4.2% of the world's population, yet we had nearly 20% of the COVID deaths. We literally did worse than any country in the world. And the people at CDC who oversaw that process, who put masks on our children, who closed our schools, are the people who will be leaving. And that's why we need bold, competent, and creative new leadership at CDC. People able and willing to chart a new course.
Representative, that was his justification as far as the changes he made. What do you think of that?
I think it's total nonsense. He's basically rewriting history. President Trump at the time initiated Operation Warp Speed, and the bottom line is it was rather successful in making sure that people got vaccinated, that the vaccines were available, and that they were made widespread, and that they were free. It's just the opposite of what Kennedy is saying. And I really think it's the responsibility of the president to remove him and to say, look, we were highly successful in Operation Warp Speed. Of course, there were some problems here and there, but largely successful in preventing more deaths, more people from getting COVID. It is exactly the opposite. And the president, I think, knows that, but for some reason he just refuses to acknowledge it, and now suggesting that maybe we shouldn't have given out the vaccines. That's not what Trump said at the time, and he should just get rid of Kennedy because he is just destroying our public health system.
Holding the position that you do at Energy and Commerce and what it deals with health care, have you had a chance to engage with any of those members of the CDC that have been removed?
Yeah, our staff met with them in the last week or so because we are very concerned about where the CDC is going without these people, many of whom have been there for a long time and are highly qualified and make decisions based on science. My concern is that science is being thrown to the wind with Secretary Kennedy. And it's not just with vaccines, it's, and not just firing people at the CDC, it's also getting rid of vital research on vaccines. Where do we go next? The next thing I'm going to say is that, the FDA shouldn't approve certain drugs because he, in his, warped sense, doesn't think that those drugs are effective. He doesn't know what he's doing, frankly, Pedro.